menstrual disorders. How we can overcome the menstrual disorders. So my topic is yoga for menstrual disorder. Let us
Sorry to
see.
disturb, ma'am, but we're not
Yeah,
able to see your presentation.
is it? One second.
Yes.
What about this?
Yeah, it is visible now, ma'am.
Oh. Yes, okay. Thank you. So my today's topic is yoga for menstrual disorder. So let us focus. What is menstruation? Before that, yoga. So yoga is our Indian heritage. Also, it's a very traditional practice of Indians. The word yoga comes from yuj, which means integration of human body, mind, and soul. I'm just going for very simple explanation of yoga. Let us see the practical practices detail. The systematic training for an individual advancements in all aspects as a physical, mental, emotional, uh, also in social relationships. It has message for your body, it has message for your mind, it has message for your emotional balancing. Also, it has message for social well-being. So yoga as a mm, very heritage practice which makes a man perfect in all aspects. Let us see how it is helpful to overcome our menstrual disorders. So, menstruation. What is menstruation? So, menstruation is a process in a woman of discharging blood and other materials from the lining of her uterus at about 1 monthly interval from puberty until menopause. So, what is happening? Actually, we are gifted with reproduction. It's a evolution. It's a happening of evolution. If there is no fertilization, it births and it discharges through a vagina. That is menstruation. It happens um, periodically, monthly. So the menstrual cycle is regulated by the complex surge of fluctuation in many different reproductive hormones. It actually controls by, it's not just our uterus, also it controlled by our hormones, particularly hypothalamus, so from brain, see, hypothalamus and pituitary. These two major glands stimulates and manages other complex hormones. So we have to pay attention all these two hormones, hypothalamus and pituitary glands. Let us see. So what are the symptoms when we have menstruation apart from bleeding? Maybe, may not. Headache, acne, bloating, pains in low
I'm
abdominal.
sorry to disturb again, but we are still in the first slide, ma'am. I think you're showing other slides too, but
Yes,
we're only
yes,
seeing the first slide.
yes. Maybe any network issues? Is it okay now?
Ma'am, it's visible.
Uh, is it?
Ma'am, we can see the size.
Okay. So headache, acne, bloating of abdomen, and pains in lower abdomen, tiredness, mood changes, food cravings, breast soreness, diarrhea. Sometimes also it happens. These are the besides bleeding we may experience symptoms. Features of menstruation, menarche. The menarche is the first puberty, first menstruation of a woman. It happens between 12 to 15 years. It's a symptom of maturation of uterus, and monthly cycle happens normally 28 days. Also 21 to 35 days a cycle, normal. If it is goes below 21 days or above 35 days means that is abnormal. So duration of periods, the bleeding happens minimum 48 hours. It may exceeds for 7 days also, depends upon the age and hormone secretion. Next, so we'll deal with the, I'm not going very detailedly of the scientific interpretation, but let us see the disorders. What are the disorders mainly we experience? So amenorrhea. Amenorrhea is the absence of menstruation for continuously for 3 months. Girls who haven't begun menstruation or puberty, attained the puberty until 15 years, both comes under this disorder. So maybe the symptoms may seen as hair loss, headache, vision changes, excess facial hair. You may feel some excess hair, hair growth in your jaw, and pelvic pain and acne. These all the symptoms. Maybe causes sometimes pregnancy where there is no absence of menstruation, breastfeeding, so feeding the child, and a hormonal contraction due to imbalance of a hormone, and due menopause, about those who are attaining due to the age of those who are about to attain the menopause stage between 44 to 50 years. The skipped periods are also common during adolescence age, when it may take a while before ovulation occurs regularly. Okay. Sometimes it depends upon your health, basic health also. Okay, hemoglobin and oligomenorrhea, infrequent or very high menstruation. Infrequent or very high menstruation, 4 to 9 periods in a year, like menstruation. The menstrual periods at intervals of more than 35 days, unusually light menstrual flow, and irregular. Maybe they see only the symptom of bleeding, they don't see frequently, and irregular menstrual periods with unpredictable flow. Sometimes if they climb the staircase, sometimes if they lift any heavy weight, sometimes also it happens so irregularly. So causes, again, the same causes: pregnancy, breastfeeding, hormonal contraction, perimenopause, and skipped periods due to the health also. Next, dysmenorrhea is a painful periods. Menstrual cramps also happens while menstruation. Pain usually begins the before your periods menstruation, and pain felt in the lower abdomen, also in your legs, any in your thighs, or any side of your legs, or back of your spine, also front of your abdominal organ, abdomen. And pain can range from mild to severe, can typically last to 12 to 72 hours. And some vomiting sensation also, you feel very tired, even sometimes loose motion, diarrhea also happens. um, it happens due to causes of prostaglandins, are hormone-like substances that are produced in the uterus and cause the urine muscles to contract. So actually, uterus need to pump. So at that time, due to the contraction, we may feel the pain, and prostaglandins also play a role in heavy bleeding that causes dysmenorrhea. Due to heavy bleeding, also we may feel pain. Other medical conditions, some other medical conditions also happens. We need diagnosis when we have a painful menstruation. Menorrhea is a menstruation at a regular cycle intervals, but with excessive flow and duration. May it exceeds beyond 70s. So menstrual flow or bleeding lasting more than a week. Inability to perform regular daily because you feel very tired because of the bleeding. Signs and the symptoms of anemia, due to anemia including tiredness, fatigue, and shortness of breath, the constant lower abdominal and pelvic pain you may feel. It's due to hormonal imbalance. I mean, particularly stress, when we are depressed, particularly if we you may feel this, not all, some people, when we prepare for the examination, the time, this stress, due to stress, our hormone secretion imbalances, ovulation problems. Some they may get the ovulation, maybe that due to the aging also, and fibroids in the urine, and endometriosis and adenomyosis, cells that line the uterus grow outside of the uterus in other areas, such as it thickens ovaries, can cause heavy bleeding. Adenomyosis is a related symptom of endometriosis. So, a related condition where endometrial tissue develops within muscle layers of the uterus. It becomes very thick, so that pumping becomes more rigid, so if we feel more pain. So medications and contraceptions, if they undergo any medications for birth control, medications, also some birth control other types of birth controls also, due to that also they may experience this. Okay. Mm, so let us see. I Do you have any doubts till here? Maybe we can discuss at the end also. So how, say, apart from this presentation only related with yogic management, I don't agree with you. This is only yoga can cure. If there is anemia, means you need some supplements. If there is any other physiological, very serious physiological problem, means you need allopathic treatment. This is yogic management for the primary conditions. Okay. If it is very chronic, means you need physician, gynecologist help. So let us see yogic management, what yoga does. So first of all, we concentrate the healthy pelvic muscles and ligaments by practices of yogic techniques, and also correction of hormonal status. Both we can do through yoga. So what are the techniques? Let us see. Mechanisms of yogic practices. So asanas. We have many yogic practices, asanas, kriyas, pranayama, and some bandhas, mudras, and relaxation techniques. We have many. I am talking about the physical practices. I am not talking about the knowledge part of yoga. Knowledge part is different. Knowledge part is completely related with the philosophical part. Also, dharana dhyana, concentration and meditation relates. Here I am dealing with physical practices, how it helps for you, for the menstruation disorders. So asana is a certain special patterns of physical alignments in our body. It deals with our body and mind. So how it helps? It improves the functioning of the endocrine glands. Certain asanas, we are going to see the asanas also, stimulates, massages, some feather touch practices also happens while we practicing asanas. So you should understand one important concept. Our glands or our glands all very soft organs, very soft organs. It those glands needs only feather touch or massage practices. It doesn't need hard and fast practices. So yoga is a very appropriate practice for to maintain hormone secretion. Okay, it promotes flexibility in body so that the muscles become supple and do not cramp or get injured. So all the techniques, it makes flexible of the internal organs. That also we are going to see the what are the techniques will be most helpful. When the body stronger, one will feel less pain as well as because your abdominal organs will become more flexible. So regular practice of asana will lead to the stretching of the pelvic muscles. Pelvic muscles. So these are the asanas. See, Utkatasana. This is like you don't worry about the names of the asana. You just see. And again, I suggest to you this presentation only for the knowledge part, not for practice. You have to learn from the a teacher. Okay, yoga experts. So Utkatasana. See, this is like a star, like chair pose. This you see here we get stretch and your anterior muscles, also compression in your posterior muscles. Again, see, this is yoga mudra. Yoga mudra is a complete compression in your lower abdominal organs. Also, it stretches your pelvic muscles. So when the pelvic, not only the pelvic bones are stretched, the uterus gets more space to relax and squeeze. So the same technique. So this is the variation of Utkatasana. See here also, this Utkatasana practice also, so very much helpful for your uterus. So this is Bhadrasana. Bhadrasana is like butterfly posture. Again, this is also very much helpful. Your core muscles gets more flexible, also more stronger here. These techniques, how to practice, are how many times you need to practice. All you need a yoga teacher. You have to learn directly from the teacher. Okay, and it depends upon your particular individual's physique. So Paschimottanasana is again the posterior stretching. Here one more benefit, your entire posterior muscles stretched. See, posterior muscles stretch. Also, your anterior muscles here, particularly in the abdominal organs, here you get more compression. So more circulation, blood circulation to the particular part of your body enhanced here. It not only for your uterus, it is very good for your abdominal organs, which enables your abdominal organs more flexible. So uterus connected. It is adjacent with other organs also. So we need to concentrate on other organs also. If there is any problem in your urinary tract, you get pain during menstruation also. Okay, Sedu Bandhasana. Again, we get more stretch. It's a complete the stretch in your anterior muscles and compression in your posterior muscles. See, here you get massage in your lower abdominal organs. See, it's massage, Bhujangasana massages. So still you can get more compression here in the Shashankasana. Not only we have many techniques. So I have given only few. Your yoga teacher will suggest you the best technique for you. It according to the personal physic condition. Some people, they may not able to fold their legs, they may not able to sit on the floor. We have alternative techniques. Okay, accordingly you get And then it's a Mula Bandha, it's Ashwini Mudra. Yogic people can catch this technique. It's actually the breathing technique. Mula Bandha, Ashwini Mudra. Nothing but see, this technique is completely holding the breath, holding the breath. See, my chin, see, the chin should touch the chest while we are adapting this pose after inhalation. After inhalation, when we bend our chin, the chin should touch the chest, so there is no inhalation and exhalation. We are holding the breath inside our lungs. So what happens? Intra circulation of your abdominal organs enhanced here. So also the pressure. So the technique is we have to pull the anus inside as per the Mulabandha concept, and Ashwani Mudra is relax and pull the anus. In Mulabandha, pull the anus and maintain for some time. So while you are pulling the anus inside, as well as you are giving compression in your throat region also, you are blocking the throat. You are blocking the throat, also your anus. Do you understand? So it is like balloon. So here you get more pressure. It's actually a very subtle practice you have to learn from the teacher. You need some more prerequisite practices also. Then only you will get the proper effect. It's also very effective. It strengthens the pelvic floor. Sorry, strengthens the pelvic floor muscles while practicing this. A subtle practice. It's a very subtle practice. Okay. And then pranayama. So pranayama is a breath regulation practice. See, you can go for, even if you are not experienced, if you don't learn practice of any traditional practice of pranayama, it doesn't matter. You can go for slow inhalation, exhalation. That would also very much helpful. One more very important concept is breath is bridge between your body and mind. Breath is a bridge between your body and mind. You can experience it. If you want to concentrate anything, is what you do. You go for slow and long breath. You go for long breath and listen. So, which means your breath controls your mind. Both are interdependence. When you are very depressive or stressed or very aggressive, that time you can feel your breath is uncontrolled. So why it when you regulate your breath, you are regulating your brain also. You are regulating your brain also. So that concept is this everybody can, even the layman can also practice this. So I don't suggest this Mulabandha and Ashwini Mudra without teacher practice, but I suggest pranayama you can practice without a teacher. Pranayama is a Sukha pranayama. Sukha pranayama is a normal inhalation and exhalation. Go for slow and deep inhalation. Only the thing, you have to keep your spine erect. So sit erect and go for slow and deep inhalation. That would be helpful to relax your mind. So the increased lung capacity as well as the controlled rhythm of breathing helps the body find great relief. It will also help relieve the stress and anxiety. So particular pranayama, Brahmari pranayama, we have to chant like honeybee. Brahmari means honeybee. Like humming sound you have to create instead of exhalation. This mudra is a gesture you have to adopt. You have to close your eyes, you have to close your nasal passage, you have to close your mouth, also you have to close your ears. So which means you are protecting your mind from the external influences. You are actually redirecting the senses through from external to internal to your mind. So automatically your mind becomes calm. When you make humming sound, makara in yogic point, makara, humming means nothing but that sound. When you make this sound, it vibrates your brain. Okay, and not only Brahmari pranaya, you can go for A U Im chanting. A U Im, nothing but Om. So you can chant A U Im separate words also. You can chant. Also, you can Om chanting. Also, very much helpful. So it vibrates the brain centers, and also regular practice, regular practice, the limbic centers of the brain. So, here only we have hypothalamus and pituitary, and you learnt hypothalamus and pituitary glands both stimulates our other complex hormones of your uterus. So, you will understand. So, why we are concentrating on our brain to overcome the menstrual disorders. Pranayama. Let us see now. Yoga Nidra. It's a very, very beautiful and not only beautiful, you can enjoy. This is a relaxation technique. Yoga Nidra. It says Nidra means sleeping in the yogic way of sleeping, but it is not sleeping exactly. It's exactly conscious relaxation. You don't sleep. It doesn't happen unconsciously. Consciously you are relaxing every part of your body. The yoga teacher will instruct you to relax from your tip of your toes to your head. So they'll take you from your toes, sole, ankles, and your calf muscles. Gradually they'll give you the relaxation. They just instruct you to bring your attention on the particular part from toes to your head. So it will also majorly helpful to overcome the hormonal imbalance, also other physical tiredness also can be an effective practice to overcome the psychiatric morbidity associated with the menstrual irregularities, apart from bringing the hormonal profile towards normalcy. It's a very effective technique. So I repeat, the yogic management of menstrual disorders mainly concentrates healthy pelvic muscles and ligaments by practicing yogic asanas and bandhas and mudras, and correction of hormonal status, practicing see, pranayama and yogi nidra. So these are the practices, but I wanted to give you some limitations also. Do not practice during bleeding. During some schools of yoga, they suggest you simple techniques you can practice, and yeah, apart from inverted postures you can practice, they suggest you. But as far as my guru's suggestion, during the periods time, because uterus keep on pumping the blood, so that time do not disturb, do not redirect the blood flow to other parts. So better relax, and at the same time do not sleep also. Too much sleep also not good, because you may get blood clots. So do not, but uh, a sitting position, a relaxation position is good, ideal for during the bleeding time. During the bleeding time, don't go for yogic practices. When there is no bleeding, only you should go throughout the 25 days or 23 days or 27 days. You practice these practices, the next month you may feel changes. Do not practice during pregnancy, all you know, and learn the yogic techniques from the yoga experts. Do not practice from YouTube and any books, and no other uh, any by listening others. You have to learn from the teacher, because everyone's physics is different. Your yoga teacher will give you the proper technique. So we have many techniques and variations according to your physics. They'll suggest to you. Okay, this presentation only for your knowledge. Clear? If you have any questions, we can discuss. Savita, are you there?
Yes, I am. The presentation was completely very useful. I found it very good, actually. So I had one question though. So while we go to gym and work out, the trainer suggests that we go daily or at least 3 to 4 times, 4 to 5 times per week. So, what do you think the frequency of yoga should be, and what should be the time we do? Is it morning? If morning is the best
Very,
time, or evening?
yeah, yeah. So, yeah, yeah, very relevant and very important questions you raised. For an yogic practice, your stomach should be light or empty. The ideal time of practice is morning, maybe in the evening also. But during the daytime also you can practice according to many housewives. They may not find time in the morning or in the evening. They can also practice during the daytime. Only the thing they have, the stomach should be light. If they had their breakfast by 8 o'clock or 9 o'clock, means at least maintain 3 hours gap. Your stomach should be light. That is very important concept. And again, um, better, not only better, my guru said, clean your bowl. If it is in the morning, clean your bowl. That is important. And take a bath. It is not other like other practices like a physical form of practices. You better practice yoga after the bath. But then also soon after the bath also don't practice. Maintain 15 minutes gap. And soon after the practice also don't eat, don't take your breakfast or a lunch, whatever it is. Again, maintain 20 minutes gap. Why when you're practicing yogic practices, you are enhancing vital circulation, the micro circulation enhanced. So it lasts for, because when you enhance the micro circulation, all the cells of your body receives oxygen, so through your blood. So when you eat, your blood circulation redirection immediately once the food in your stomach, the circulation redirected to your stomach. So your heart may have heavy load. So better another 20 minutes don't eat. Soon after the bath also don't, because once you pour water in your body, again the circulation enhanced, that time again overload to your heart. 15 minutes gap after the bath, after your bath. After practice, 20 minutes gap, maintain it. During uh, during menstruation, during bleeding, don't practice. If you have any cardiac problem or any other hypertension, such epilepsy, these people, you need a yoga therapist. uh, Tailor-made practices, you're not fit for general practices. Again, if on the particular day, if you don't sleep the previous day night, or a particular day, if you're feeling tired, means please avoid the practice. Any other questions? Am I reached to you?
Yeah, yeah, it was very clear.
Then
Uh,
any other questions, please?
I think there are no questions. The presentations was very clear that there are no questions.
And thank you, Savita and team, for your initiation and for your efforts. And I pray for you should shine more, and you conduct organize such events relevant to the scenario of need of the public, need of the society. Thank you, thank you, thank you, all of you.
The
Thanks.
pleasure is completely ours. Thank you for presenting at our session. I think this is an important session since a lot of people now are suffering with menstrual disorders. Their PCOD and PCOS cases are particularly high at this time.
So I think in uh, yeah, thank you. So shall I
Thank you, ma'am.
so with your permission, shall I log out?
Sure, ma'am. Sure, ma'am. Thank you.
But
Thank
I'll
you
be
so much
listening.
for presenting at the
I'm
event.
not logging out. I'm
Okay.
actually stop my sharing. I want to listen other your two presentations of your colleagues. Okay.
Yeah.
Thank you.
Yes. So from my team, there are two presenters,
Ah,
and I want our other founder, Tamilarasan, to introduce them.
yeah. Thank you. Thank you.
Thank you so much, ma'am.
Ah.
Thank you, Savita. Thank you, ma'am. Thank you so much for the insightful speech on the yoga for menstrual cycle and the menstrual disorders, and introducing us some of the yoga practices like Utsanava, Yoga Mutra, and Bardhanasana. And I really liked Yoga Nidra, that is conscious sleeping. I think we students most of the time do this yoga in our classes, and really it was an insightful message on how a routine yoga can incorporate a better menstrual health. I really want to thank you again, and my I want to introduce myself. Greetings everyone. Myself Tamil. I'm a founder of Scioverleaf, and I'm currently pursuing my BTech Biotechnology. Today, I am delighted to introduce Sathya Rajagopal, our current Chief Coordinator at Scioverleaf. Today, she's going to present us with the topic Cervical Cancer Awareness in aiming to inform, inspire, and impact communities. I wish her all the best. And Sathya Rajagopal, the dice is all yours.
Thank you, Tamil. Am I audible?
Yes, Satya, you're audible.
Sathya, you're audible.
Is my screen visible?
Yes, it is visible. Yes.
Okay. Welcome, Unstoppable Souls, to our Women's Day celebration tonight, hosted by Scioverleaf. And cheers to the power of every woman present and dreams yet to unfold. Firstly, I want to thank Dr. Sudha ma'am, who uh, done a very delightful information to all the women out there. I love this quote when I read, and I want to share this to you in such an occasion. Behind every successful woman is herself. As we gathered here to celebrate Women's Day, I'll be shedding light on the topic Cervical Awareness Voyage, Inform, Inspire, and Impact. Before we delve into a serious stuff, let's make a quick laugh. So the picture is me, which my organization made me to have it. So I'm Sathya Rajagopal, currently pursuing BTech Biotechnology degree in Rajalakshmi Engineering College, and I am the chief coordinator at Sai Overleaf. Yes, back to the regular scheduled program on the cervical cancer. Even though it is the most common cancer among the women globally, and we have effective tools to prevent it, but we are leading in it. Of the estimated 600,000 new cases annually, approximately one fifth are from India, and that is 124,000 new cases and 77,000 deaths annually. And this number increases of women who dies from pregnancy complications and maternal mortality. And as the fact says, cervical cancer is the second most common cancer after the breast cancer in India. And now everyone knows everyone knows a breast cancer survivor, and I am sure if I ask one of you to show me one, you could raise hands. But if I tell you to show a cervical cancer survivor, it is difficult, right? So why does this happen? Because mostly people most of us misinterpreted with what the cervix is. Like an example, in a TED talk hosted by Dr. Neeraj Batla about cervical cancer prevention, a well-educated woman commented, "Cervical is so common these days," which she reflected to neck, which is cervical spine. But here we are talking about the neck of the womb. So let me clarify that we are talking far more than it, which is the cervix cancer of the uterine cervix. And In 1800s, people claimed that women who have multiple partners tend to get these cervical cancers. But today, we know that every woman is at risk of acquiring it, and the infection leads to cancer. And 80% of us are going to get it. And among rural women and economically disadvantaged women who have risk factors like early marriages, multiple pregnancies, reproductive tract infection, poor access to healthcare and treatment, their voices are often unheard. But cervical cancer is undoubted strategy, truly a preventable one, and it is slow growing and it uniquely has a long pre-invasive phase as much as 10 to 15 years, which is termed as CIN, which is cervical intraepithelial neoplasm. And if it is detected early, it can be completely treatable. And this man in Germany, Harald Zurhausen, discovered that the DNA virus HPV was the root of this problem. So he was awarded a Nobel Prize in 2008 for this momentous work. This paved the way for discovering vaccines. So I want to just look at this animation and explain how we get an information about how the HPV virus infects our cervix. So this is the human papilloma virus, and which is the leading cause. And if untreated, it will be led into the cervical cancer. So just look, we can look at a healthy cervix. So the uterus ending point is called as the ectocervix, and the phase where the uterus and the vagina connects is called as the endocervix, and the transformation zone is where this is between the both of them, and this phase is typically where the HPV affects. And there are two types of cervical cancer, which is squamous cell carcinoma and adenocarcinomas, which is up to 9 out of cervical cancers are squamous cell carcinomas, which is formed from the ectocervix. And the most not prevalent one is called as the adenocarcinomas, which is develops in the mucus producing glandular cells of the endocervix. And the next phase, we are going to deal with how HPV infects the uh, cervical cells. So this is a naturally occurring micro tear because of the sexual contact. So HPV infects in the basal cells uh, where the it is present underlining of the active cervical cells. So these basal cells differentiate into epithelial cells, called as stem cells differentiate into epithelial cells. So when this cell is infected with this HPV, this reproduces new copies of the virus and it leads to the epithelium. So this will be released into the epithelial cells and make the epithelial cells in the deformation of a structure. This is how the it is mixed, and this is detected by a pap smear, which we will be telling up in the last. This is the phase where we can detect the precancerous cells. This animation shows that most of us have immune system to control it for the HPV virus, but if HPV is not cleared by the immune system and if lesions are not detected and effectively treated, cervical cancer can develop. And here are some symptoms by which the cervical cancer can be detected. So most women in early stages of the cervical cancer typically have no symptoms. During this stage is the earliest sign of the cervical cancer. It is likely to be an abnormal pap smear. As I told beforehand, cervical cancer develops very slowly, and this symptom-free stage lasts for 7 to 14 years. And through a pap smear, we can detect the precancerous cells, and that are 100% treatable. So the most advanced stage is when women doesn't go for a regular pap smear, or the women who got an abnormal pap smear and does not follow up a doctor. So those women can end up like symptoms like watery or bloody vaginal discharge, foul smell of vaginal discharge, abnormal or increased vaginal discharge, vaginal bleeding after intercourse or after menopause, and increased vaginal bleeding. And if the cancer is spread to the adjacent tissues, then the symptoms may be pelvic pain, back pain, painful urination, fatigue, and also weight loss. So these are some risk factors of the cervical cancer. As I told beforehand, HPV is a necessary cause for this. This is maybe a current infection or a past infection or the repeated infection of the HPV virus. And especially the variants 16 and 18 are far more dangerous than the other variants. And other factors that could cause this are unprotected sex, history or presence of the STDs, sexual intercourse at young age, smoking. Smoking, as I told before, the immune system can clear up HPV virus, but smoking suppresses the immune system and prevails to have a cervical cancer. And other factors like poor utilization of the screening, which is a pap smear, and family history also. And as the display says, cervical cancer is one of the most preventable and treatable type of cancers. So what can be done to avoid it? So prevention is can be broken out into primary prevention and secondary prevention, where primary prevention is where you can get viral HPV vaccination. The vaccination against the HPV is going to be very important here. So there are two types of commercially available vaccines in market, which is Gardasil, works for HPV variants of 6, 11, 16, and 18. And the other one is Cevarix, which is works for 16 and 18. So HPV vaccination is probably the ultimate prevention strategy, and it would not only prevent the cervical cancer, but would have other spin-offs too. Like it can prevent anal, oropharyngeal, vulvar, and vaginal cancer too. The quadrivalent vaccine also prevent the genital warts. So the recommendations by the healthcare department is that the women who are 9 to 26 years can take up the vaccine into, there are 2-dose series and 3-dose series, which in 2-dose series, the first dose is given and the second dose is given after 6 or 12 months. And in the 3-dose series, first after the first dose, 1 to 2 months after the first is the second dose, and third dose is after 6 months. And this is for before 2018, but after 2018 publications, women up to 45 years also can take up this dose with a physician consent. And coming to the secondary prevention, if the patient had an HPV, they can go up for pap smear, which I will tell, which I tell in shortly, which detects the precancerous cells, and they can go for HPV serologies too. So pap test. Uh, this does not sound very serious as it sounds in the advertisements, but it is used to screen the precancerous cells. You can treat the cervical cancer beforehand, and I'm going to give you a laydown on how pap smear is done. It only takes us 10 minutes. First, your healthcare provider will be provide instrument called a speculum, which is this, and it will be inserted into your vagina to be open so that the cervix can be seen. So next, you will be provided with a scalpel or a soft brush type, uh, where gently they collect your cells from the cervix, and these cells will be examined at the lab, and it usually hardly takes 2 to 3 weeks to get the results. It is just uncomfortable, but it is not painful. You can take it and prevent the deadly cervical cancer. And if you are uncomfortable with this procedure by a healthcare provider, you can take at home vaginal swab collection kit, which is given by many companies. They will where you can itself you take your cells, and you can put it in a bottle or something that is given in the kit, and the delivery person will take up your cells, and they will transport it to the lab, and you will get the results. So the government also take up a step to prevent this cervical cancer, because it is leading as like we cannot see the numbers behind them, but it is leading in the India. As in Budget 2024, Ms. Nirmala Sitharaman advocated to enhance the cervical cancer vaccinations for the girls of age 9 to 14 years. And AIMS also provides 262 doses of free vaccine. And Dr. Singh told they can provide more vaccinations in the future. But now it is available in private care centers where you can take up the dose. Uh, on Before we wrap up, our health is our wealth, and it's never too late to focus on our well-being. I want to extend my heartfelt thank you to each and everyone for joining us today. Thank you for attentive participation throughout the session. Uh, I hope this helps, and get your pap smear done or take up your vaccinations to prevent this deadly cervical cancer. Yes, let's meet in another session through our journey together. I can take up questions if any. Thank you. Thank you so much.
Thank you, Satya. Your presentation was very informative and impactful. So, I'm Tarangini, your other chief coordinator of Scioverleaf. Okay, moving on to our next event. We all aspire to have strong bones to carry us through our ups and downs of life. But what happens when the foundation weakens? We have Shaziya over. Okay, I think someone has a doubt. Yeah.
Yes, you can ask. Okay, if you have any questions, you can take up in the message box. Currently, you can take up on Sasha.
Okay, so yeah, as I said, I'm Tarangini, your other chief coordinator at Scioverleaf. We all aspire to have strong bones to carry us through our ups and downs of life. But what happens when our foundation weakens? We have Shaziya over to talk about osteoporosis and bone health.
Good evening, everyone. I'm Shazia, and now I'll be talking about osteoporosis and what it actually is and what we can do to manage it. Let me just share my screen. Is my screen visible?
Yes, ma'am.
Thank you. So, my topic is battling brittle bones and strategies against osteoporosis. This is the last presentation, so I'll be talking about it briefly. So I am pursuing BTech Biotechnology in Rajalakshmi Engineering College, and also I am a writer over here at Scioverleaf. Okay, so first I'll be talking about what osteoporosis actually is. Yes, so it is a disease characterized by low bone mineral density and deterioration of bone tissue. It can simply be understood as like with increasing age and due to many factors, our bones are getting shaved off over here. Okay, so like this is the diagram of a normal bone compared to that of a disease afflicted bone. So we can see like the difference. The disease afflicted bone has a lot of pores, and these pores are actually generated in the bone due to loss of mineral density and other things, important factors such as calcium. We'll see why it happens actually. And when bones gradually get shaved off, yes, there is an increased risk of many things such as fracture, most commonly in the hip, spine, and wrist. And if we go to the statistics, around 200 million women worldwide are affected by the disease, 22% women and 6% men. In India, approximately 50 million people are affected. Now, one important thing that we notice over here is in this affects women mostly when they hit menopause. Now, menopause is a period when there is permanent stoppage of the menstrual cycle. There is no more secretion of estrogen or very minimal secretion of estrogen in the body. So, as soon as the period of postmenopause hits, there is onset of this disease in a lot of women. We'll see why that happens later. And risk factors. Now, there are a lot of factors which can actually cause this disease in women. For example, with advancing age, we just saw that this disease is most likely to occur with menopause. And then due to genetic factors, it can even occur early with if it is because of genetic predisposition. And then due to estrogen deficiency, and then low body weight, calcium or vitamin D deficiency, which we know are very important in maintaining bones, and then due to no exercise and excessive alcohol and smoking. Now we'll actually talk about what estrogen does briefly. Now in our body there are two processes, okay, bone formation and bone dissolving. Our tissues are actually regenerated after a period of 100 days or something. So like we have a whole new set of cells after 90 days, something like that. So when bone dissolving and bone formation, both of these processes occur simultaneously, okay. But what happens is estrogen is a factor which maintains that balance. But when that balance is lost, the rate of bone dissolving occurs way more than actually the rate of bone formation. So we are actually losing a lot of net bone mass. So when this happens, this is when we lose a lot of bone density and the disease actually occurs. Now, as long as we are menstruating, and that is till we reach something like 50 years or 60 years, estrogen is there protecting us and our all of the bone system in our body, yes. But as soon as we hit menopause, estrogen goes down and we immediately lose the protection and our bones become prone to the disease. And then let us talk about the symptoms. Now, from even minor falls or like just slight triggers, we can see that our bones actually break from falls we don't even expect it to. And then loss of height over time. This is very slow, but it can still be visible. And then we have all heard about rounded shoulders and then hunchbacks. All of this is possible. And sometimes what happens is there is such minor disc erosion, bone erosion in the spinal column, which is composed of 100 of small bones in the vertebral column, that something called slip disc can happen. And all of a sudden, that can cause a lot of massive back pain. And the diagnosis is late in this disease. That's what I'm saying. And then what can we do to manage the disease actually? So the first thing, we are losing calcium over here, right? So the most obvious option would be to intake calcium supplements, 100 to 1200 mg daily, but it is always better to take a doctor's prescription. And then also ensure we get enough of vitamin D, performing weight bearing exercises. Actually, when we perform weight bearing exercises, that is when we put pressure on our bone, that stress actually triggers cells to form bones, so that can also help. Then limiting smoking and alcohol, and having our bone density tested periodically after menopause, just like we do disease screening every year, like we can also have our bone density checked. Now, let me just explain briefly about two methods of screening and diagnosis. The first picture you can see over here, it is actually a gamma screen bone test. What actually happens over here is we are injecting a radioactive material into our body, and that material is concentrated in regions of high bone activity. Like when it detects really high bone activity, for example as in fractures, that substance gets collected over there, and we put this huge scanner over our body, and then, like, we can see it in the auto radiograph, so we immediately identify that okay, there is something wrong over there, and then the radiologists and the doctors can take the next steps. And then we have the FRAX tool. That is like a statistical tool to measure the risk. Like, even if there are no fractures, they just go through the entire body, calculate stuff, and like, they give us a result of how much of risk we actually are at of getting a fracture very soon. So we need to be careful that we don't fall down anywhere and stuff like that. And then let's actually go to how now there is no proper, like, one stop solution for all of these. So the best thing you can do is just manage the disease. What we can do is we can intake biphosphonates like alendronate to slow bone loss. Now we know that it is occurring, so the best we can do is to slow down the process, right? And once women hit menopause, they lose estrogen, so like they can also intake estrogen as therapy, and then they can take calcium and vitamin D supplements, which are very important. And then weight bearing exercises, they can be careful to not fall anywhere, just like I told. And then anti-resorptive drugs. Now, resorption is nothing but dissolving or erosion of bone. So if we take drugs that combat that process, it is good for the system, right? So we need to take drugs that have fewer side effects. We need to be careful with that. And we can prevent the rate of bone dissolving, and at the same time take anabolic agents to enhance bone formation. Combination therapies is just taking both of those drugs together. And surgical interventions, there are when, like, there's a lot of damage done that a person cannot even move or stuff like that. There are certain procedures called vertebroplasty and kyphoplasty. I'll just explain what one means. What happens in vertebroplasty is the doctors, they inject and they make an incision into the vein and the bone where there is damage, and they insert bone cement over there. So the bone cement immediately fills that hollow place, it gets hardened, and that's it. We get our structural stability back in the bone. It is just like, filling up something, filling up a hollow space. We have to go for surgeries very carefully, actually, after, like, examining all the possible risks and stuff, because it can be dangerous otherwise. And today we have spoken about yoga. So it turns out yoga is also a very important factor in managing the disease. There are a bunch of poses such as Trikonasana, Setu Bandhasana, and Salabhasana, which can actually help in spine strengthening, weight bearing poses, balance and stability, mindful movement. It helps us to be careful, improves our balance, and strengthens the weakened bone and muscles, and reduces fracture risks. And also, like, what can we actually do to, like, prevent this overall, like, reduce the number of women, like, by this, even if we affect one woman to be more careful, take care of herself better, and educate her about the disease, we are successful, right? So creating awareness is very important, like with webinars like this, and then support groups and community organizations for people with this disease, but they're not aware of it. They also need to be educated on how to manage it better with educational materials and online resources, and collaborative research. Just increasing awareness overall can actually help a lot in the longer run. And that's it. Thank you so much for listening.
Thank you, Shazia. The session was very good. I think osteoporosis is also very common these days, with knee pain, back pains with everyone. So we also thank you for listening to us. Thank you for being here with us all this long. We also wanted to introduce Scioverleaf formally to you all. So our presentation is here. So 5 more minutes of your time, and we'll end the session. Thank you for waiting patiently with us.
Thank you, Shazia. It was a wonderful lecture about osteoporosis. So I'm going to take a little amount of your time. So in Scioverleaf, our blog. So this blog started as a small group of people writing research works on our own terms. But now we want to grow, and I think this is the first step of us growing. So introducing you, Scioverleaf. So who are we? So we are just interested peoples in research, and what we want to do is eagerly bring students who are also interested in research to an area or a platform where they can connect with peoples and tune knowledge. So this is our motto, and this is what we are going to focus on. And you can follow us on our LinkedIn page and our Instagram pages. Our regular updates on the research works will be published by our writers. You can read about them, you can comment about them, you can share them, and spread our knowledge. Thank you so much for attending this lecture. I hope this was a great evening to you too.
We've shared a feedback form in the Google Forms in the chat session here. People who need e-certificates can also fill in. There's an option there. If you need e-certificates, you can fill in yes there. Please fill that in. And as a part of Scioverleaf, we are also inviting students who are interested in writing articles to join our blog and write with us. Thank you everyone for joining with us today. And I want to give my special thanks to Dr. Sudha Ragavendran. She gave an incredible speech on yoga and made the session very insightful. And I also wanted to give a special thanks to all the faculties that were here with us. Kavita ma'am, Premalata ma'am, Preeti ma'am, Srini ma'am. So they all took time out of their busy lives to join with us on a Saturday night. And I feel very honored for that. Thank you so much for joining us, ma'am. Thank you so much, everyone. After filling the feedback forms, you can leave the session.
Just a note, if you want to join us in our writing articles, you can find the link on Instagram or LinkedIn. You can fill the form.
We have social media platforms we have a social presence in Instagram and LinkedIn. So we've pinned it there. We are still hiring. Our hiring recruitment is ending on March 31st. You can write on it if you're interested. Thank you, ma'am. I'm receiving a lot of messages in the chat session. Thank you so much. And we are glad that you all enjoyed this session. And the main takeaway here is to spread awareness, and spreading awareness always takes us one step closer to defeating the disease. Thank you, ma'am. Thank you, Preeti ma'am.